Hi everyone, this is Dr. Marra with Dr. Marra's Medical Minutes, and today we're going to talk about appropriate testing for tick-borne illness and what labs I would suggest that you use. Um, as you know, it's very, very difficult to capture these organisms. And so one of the things I do is I do a 14 to 21 day challenge with 8 to 10 herbs, and you start low and go slow. Keep adding until you reach 20 drops twice a day, and then you take the blood test. But before you do the blood test, you want to exercise for an hour. You can just sit and do this. You want to get your blood moving, and if you can, try and get a deep tissue massage. The the deep tissue massage mobilizes the organisms out of the deep tissue and dumps them into the blood. And so you can better capture the antibodies against them. It's a technique I've been using for more than 25 years, and it's really, really effective. And the reason I developed it was because in the state of Washington, you cannot treat um, presumed tick-borne illness without positive tests. So I had to figure out a way without using antibiotics to do an antibiotic challenge to get a positive test. And so after several months of trying, I finally perfected it. And there is a group of herbs that we use to provoke the organisms. And and then it increases the likelihood quite a bit of getting positive tests for any of the tick-borne illnesses that Igenex measures. The labs that I currently use is Igenex, and I do use DNA Connections because you can order that online yourself. You can also order Igenex AccuDart online by yourself and have that done at home. So that's also a very good uh, way to document that you have tick-borne illness before you even see me. The problem is that you won't have had the challenge, and so if you want to do it, you can, but you can't be guaranteed that's going to be a positive test. So 14 to 21 day challenge, depending on how long the person has been infected. Obviously, the longer infected, the longer the provocation, because the organisms are so deep in your tissue. I have to get them out. So 14, 21 days provocation, the day of the blood draw, which needs to be a Monday, Tuesday, or Wednesday. You go and get your blood drawn at Anytime Lab, Anytime Lab .com, and they'll draw it. And for women, you should do it a couple of days before your menses. So a really good idea to get your tick-borne illness testing right before your menses, because that's when the organisms are at their highest. That's why you have symptoms right before your menses. So I hope that you have found this information useful, and I hope you have a wonderful day. Take care.